This background is unnecessary. It's literally just to make it easier to record this video in decent quality with a camera. Hi. So today's presentation isn't for pity or a sob story, but to raise a global issue. Can I place this camera lower? Maybe angle it down a little. Okay, so it's about the mental health system. Now, my name is Kevin LaLiberty. I usually announce myself as Kevin Chaos. Today you get my regular name. I'm Kevin LaLiberty. I have been diagnosed with ADHD, attention deficit hyperactivity disorder, right? Bipolar type 2, okay? Obsessive Compulsive Disorder, post-traumatic stress disorder. I think the hardest one probably for me to deal with, or for others to deal with, perhaps, Aspergers Syndrome. Bah. Okay? Now, a little bit into that. Asperger's makes communication difficult. I've seen a woman with Asperger's who teaches teachers who teach other people who have Asperger's hold a seminar, put it like this once. Because you guys see my presentations, and I do a relatively good job, right? Well, so did this lady. And one of her common questions, they said, well, if you have Asperger's and if social stuff is so difficult for you and there really is no medication that aids in that at all, by the way, then how are you able to do this? How are you able to get up on stage and speak to us? And the woman says, well, it's simple. This is my show. I'm the presenter. If you don't like it, you are free to leave, but I feel in control. Well, with Asperger's, our social etiquette, our intelligence is usually, and there are many ends of the spectrum when it comes to autism. But for some of us, our IQs are actually extremely high. And like they say, where a rocket scientist might not know how to use a calculator or some metaphor like that, some of the simpler things in life are much more difficult, like daily social interactions. In the words of Tim Minchin, the comedy song comedian, I've always found that line difficult to navigate even in my own personal life. And you can see him as he do his shows with pure anxiety the whole time. Other words this woman presenter said was something along the lines of, your anxiety when you're at 10 is ours at 1. That's our normal state. Unfortunately, there isn't a whole lot of medications or things that actually help this. And my video here today is about trying to seek help with mental illness, any kind of true aid, when people treat you like a problem, a monster. No matter how genuine, no matter how long your paragraph, no matter how earnest and sincere and loving and real you are, somewhere in it is some word that's going to be taken out of context, or perhaps confidence mistaken for narcissism. And they will blow that part out of proportion and focus on a small portion of the real thing you're trying to get at. I've had great difficulty. I'm 30-something years old. I don't even keep track anymore. But I've had great difficulty navigating other people. I'm happy on my own. But other people want to be involved with me and expect me to more or less mimic their behaviors, to act like them. I know that that works, however, because their desires and their statements are very different. I'm speaking along the umbrella of Asperger's, and I will move on after this to why I don't believe a lot of us can get the help we need for ADHD and bipolar, and why and how we might improve the relationships to get us that help. So, for me, I over-explain everything. Not because I'm looking down on you or I think you're stupid. I talk with confidence because I'm educated on whatever it is I'm mentioning. I don't talk about things that I'm not educated on because it's already easy enough to make people mistranslate me to have me look like a fool or to be angry. So I don't really talk about anything unless I already know, or I'm passionate and I love learning, and I'm glad to see even things that I might not agree with in the long run, your perspectives of intelligence, religious paths, or whatever it is that people can differ on. And I would respect whatever path anyone takes. Part of why I wear this symbol. Okay? Now, so communication is difficult, and it's not for the lack of trying. Quite the opposite. I spend great deals of time researching and rehearsing and trying to find, walking on eggshells, the right way to approach people. And people really don't like direct, and they don't really like being informed, or those sorts of things, it seems, because to me, the way that we process things is through information, not through the natural symbiotic relationship that regular people have. Aspergers don't really have that. So we digest things through information. And that can make things difficult in a world where we wear mini masks and outfits. You know, you dress a certain way to go to church, a certain way for some families to eat. They call it dressing down. I call it dressing up. We use art of sarcasm and mask insecurities or dark humor that might be taken to heart by some. So there's a lot of hoops that everybody's always jumping through anyway to try to engage in reaction. And I come very sincere and earnest, like I am in this video, about trying to build that rapport with the person. But in my experience, no matter how much you talk or how good your will is or wishes, people perceive things just like I have my unique, I need the info way. People perceive things from their own mind, not from new resources you've handed to them. Which is why I've made videos on stuff like entitlement. When people get to a certain level of expertise and are no longer open to interpret new information and instead rushing toward the quick fix, the exit of what might have worked for someone, some other patient, some other friend, something in their past before. But I'm not their past, I'm not that other someone, and I'm not some other patient. In order for us to really be able to function in the world, any of us together, successfully, without lies or manipulation, or bombarding and trading who's dominant over one another, it takes communication. In the words of a fake psychic on Mallrats, the Kevin Smith movie, which is my favorite one, even though he thinks that it's no one's favorite Kevin Smith film, the fake psychic said, understanding is only reached first through confrontation. And so we need to be able to communicate. Now, what happens if that communication is difficult or we get into our feelings or offenses over what words mean? More often, I find that other people are offended than I am. And it is not my intent to belittle them. When I say that I'm smart or intelligent, it is not to say that they are not. It is to say that I'm confident. It is to say that I'm not belittling myself. It is to say that instead of beating myself up, even while I'm not really fitting in, I'm special too. That's not to say that you're not. Or maybe I might express myself and talking about myself, someone gets in their feelings to make there's somewhere something hurt them in the past. And so they're triggered into a part of that statement, bringing up a feeling and modality of thinking that will paint you into being an enemy. And where they might not directly claim it yet, but eventually decide so. They feel that you're opposing them. Okay? They feel that you're against them because the information you're trying to give them, maybe you're talking fast and you're manic and they need you to slow down, but the way that you're giving them information is not being well received. It's a new type of thinking or behaving. It isn't their type of behaving. I always say that there are no true teachers. There are only guides. People teach themselves when they're ready to reword. That's what meditation is for, to gaze and think about something for a time, to have understanding on it. Anyway, sorry I'm kind of stressed a bit, but we're going to power through it. Also combating the fact that it's freezing in the house with things I'm going through with my landlord. Anyway, so there's also a problem, so I mentioned entitlement, with education. And this is not to say that other people don't have intelligence or education. This is to say that all of us can constantly grow. To quote the Greeks, the only true understanding is in knowing that we know nothing. We need to be humble to new information. I'll give you an example. A couple of them. Two off the top of my head. When I went to try to get help one time through the emergency room and wanted to get admitted to a mental hospital, having a lot of anxiety, a lot of depression, a doctor approached me. And I've had this conversation 3 times with everybody else. You answer the same questions over and over. And the doctor says, so I see you have ADHD and bipolar. And he's manic, more manic than me. And I'm not manic right now. But I normally talk like this, and this is how I prefer to be. I don't like to slow down, but I can if I need to be. So he comes up to me, and he says, so I heard you have bipolar and ADHD. Well, I'm going to tell you that I give all of my bipolar and ADHD people, I think it was Cyprexa and Depakote. And I said, well, keeping myself calm because I know he's not hearing me. He didn't read the chart that says I'm allergic to Depakote. So first I handle it right at first. And I say, well, I'm not all of your other patients, but I have to tell you that I'm allergic to Depakote, and so is my brother. Well, I'll check back on you. Maybe you'll change your mind. And he prances off. Comes back not even 10 or 15 minutes later. So, are you willing to take that Depakote? He actually clapped it, but I don't have 2 hands available. So, you ready to take that Depakote? At this point, I'm a little more upset. I don't care if we're in a hospital, if I can have some bad reaction, and you can revive me. That was quite stern, but I'm not willing to take something that I'm allergic to. Well, I cannot help you. Poof. Off to the next idea. Didn't get the help, didn't even get in the hospital. I'm seen as argumentative. I'm seen as opposing. I'm seen as resisting, and all of these other lovely things that when people let knowledge go to their heads, they think they rule and understand everything. But the fact of the matter is, my friends, we're not the same. We all have different unique brain chemistry, especially for the Aspergers. And while we struggle to deal with the world or to get the help or to learn how to do all of that, we're met with the opposition, not the other way around. I'm taking the time it takes to make this video right now. That's not opposition. That's me giving you the tools to understand how I am, how I talk, how I behave, that should you choose, you can decide we're friends or business partners, or that you have a service to provide to be able to help me. Another example. I had a shrink. I won't recall her name. I didn't keep her long. You'll see why. And I come in there, and I really would like to be helped, but there's 2 things that occurred that just let me know that's not going to happen. And I don't need to yell at her or say anything nasty for that, but I need to find someone that wants to build a rapport like they're supposed to. A client and a doctor to be able to provide the services necessary for him. If you don't build that rapport, if he has worse illnesses than me, you're just going to get him to go down a downhill slide. Not to feel that he can trust, which is very important for therapy. It's very important for pharmaceuticals. This aid coming in. And unfortunately for me, I've had a lot of negative side effects on pills and stuff. So it's really hard for me to keep opening up to new, more dangerous stuff when I've even done the research on top of my history, which we'll get to. But there's 2 things that happen with this doctor. The first, day 1, literally. I walk in, I see a poster on the wall, or a suction on the back of the door, and it has a bunch of different brains with different colors. I guess it's supposed to be like an EEG or something. I don't know. I don't know the right word for it, but where it shows all the colors and tells them stuff. And there's a name of a drug underneath each brain. There's 2 rows of brains. One brain is just pink, fleshy pink. And underneath it says normal. At the top of the poster it says, which brain would you rather have? I looked to her and I said, how can I answer this? And I was calm. It's confusing to me. Asperger's likes to ask questions. It wants to understand the world. And the world don't tend to make sense. Their emotions don't match their actions. Their emotions don't match their thoughts. And we crave structure. We crave information to digest, to be able to sort it all out in our heads. So she pretty much answered me, unfortunately, like you would expect. Well, obviously you want the normal one. I said, well, is it obvious? There's no information. It could have like a color code or something on the right. Even like telling me a chemical imbalance of well, cocaine affects the brain in this way, or marijuana affects it. There's no information for me to understand what's good and bad here. Normal doesn't exist. Normal's whatever closest matches yourself. So how do I answer that? Of course, she can't answer. She's just quiet. She finds out I make music. many genres, many ideas, some contradicting because it is a creative expression. It's an art. Okay, so I might be writing in hyperbole and metaphor, creativity. It might be a dark sense of humor in some tracks, but she asked to see some of my songs, so I come back the next visit with a flash drive. Thumb drive, U disc. If you don't know what's what, I like listing stuff. Anyway, it's probably Asperger's too. Over-explanatory, but anyway, I'm bringing in, slightly embarrassed, a flash drive with my songs both in playable MP3 form and also in text document form. So no matter which avenue you prefer, you can check it out if you want. You asked me for this, I'm complying. So she opens it opens up one of the text documents in Notepad for one of my song lyrics. She reads a line or two. I'm watching her watch the screen. Scrolls down 3/4 of the document. Reads another line or two. Scrolls to the very bottom. Reads the last line. Then she turns to me, about to tell me what she thinks I said. I'm sorry, ma'am. I don't want to hear what you have to think. Does that mean? Said, I don't want to hear what you have to think. You don't know what I have to think. You didn't read what I had to say. I could be speaking in metaphor, a dark sense of humor. How are you able to tell me what you think if you didn't even take... I mean, the whole song being played is 3 minutes. I didn't say that part because it seems condescending. But how can you tell me what you think if you don't know what you're reading? And quite similarly, the poster, right? So I decided to try to find a new doctor. But then you come across a new doctor who, quote, doesn't feel comfortable dealing with dissociative identity. So literally I lost my new shrink once I started to express stuff on the topic after I finally built a good rapport with a new doctor. I don't feel comfortable. I'm uncomfortable. Okay, can you refer me to someone? Nope. It's just, I'm done with this job with you. Damn, that sucks. So, now we fast forward a little bit to even dealing with a hospital van ride to the hospital. Passing out. Horrible, horrible experiences. Heart palpitations. Lethargy. A whole fucking list of symptoms that I never expressed. I've never felt so bad in my life. You call with your Asperger's and your anxiety to get help, and you might be a little panicky from what little breaths you can gasp to complete sentences, right? You get in the hospital van and these volunteer rescue squads and all these different people, you know. And the guy that takes care of you, on the way there, demands that for my safety, I put on all of these extra straps and basically hyperventilate until the next anxiety attack. So he straps me to the bed. I got kidney stone in me on top of all the other shit happening. So, my health was already starting to have all these bad things, and then suddenly I had this. Woke up from it. Never had that before. Horrible pain. So I'm like, I can't. I gotta at least bend in a way that's a little less painful, and I can barely fucking breathe. I have these illnesses, and try to tell him as calmly as I can, as clearly as I can. Oh, you're just not gonna cooperate, are you, huh? And, because on top of that, which I did already cooperate, he asked to put on the blood pressure machine. And I asked if he could wait a minute for me to collect my breath, and that's the response I got. It breaks my heart. Not for me. Again, this isn't a pity store. But for everyone else. I have Asperger's, and lucky for me, I'm high functioning in the autism. I do relatively okay. But for all the other people seeking help, I can only think how much of a bigger struggle it must be for them, those who can't articulate so well. So, what we can do about it, I think, and what I hope to happen while I choose not to have a lot of friends, not because I'm antisocial, as is the common assumption. I'm not. I'm very social. Look at this shit. And I love my life, and I love my friends, and I love strangers, and I have a general, most of the time, good vibe about things. It's not very often I reach the low end. But we don't hear each other these days when we speak. It don't matter what the political issue or friendly issue. We don't really listen to each other unless they're speaking like we speak. I resonate with that, so I'm going to keep on tuning in, but how are you going to understand? How do you know we don't already agree unless you hear the whole thought? And unfortunate for me, I talk like a paragraph. It's very difficult to summarize things in a well-taken manner. So I make sure to over-elaborate so that there's less chance of being misunderstood. But unfortunately, it makes me more understood because it gives them more details to find something wrong to pluck out. So I think that what we can change in the medical industry, and a lot of professions really, is the relationship between the client and the caretaker, whoever they are, doctor, shrink, priest even maybe. That they treat you like a person, an individual human being, instead of a past memory of someone somewhere else of something that worked. I also think with medications, that's where we're going next here, we need to cover the actual facts, not just throw stuff at it and hope it works. Did you know that SSRIs are literally effective only 50% of the time? That's a literal coin flip. It turns out, and these are studies going back to 2009, that there's almost almost no overlap between depression-related genes and stress-related genes, and it was once believed that they were related and that one would cause the other. So how we diagnose medicine for antidepressants is something called selective serotonin reuptake inhibitor, which means it targets particular chemicals, and hopefully that's the chemical that's imbalanced in your brain. But since we're treating the conditions the same way that we always have, we're still treating it as if those two things are related, and it turns out that depression starts higher up in the chain of events in the brain. So the 50% of people that do get help, only half, are just because they actually targeted the right chemical randomly with their guesswork. This is why it takes so long and you have to get it in your system so long for it to work. This is why they have to try medicine after medicine before you finally, hopefully, find something that works for you. And that's just bipolar medications. Let's move on to ADHD and anxiety. Anxiety will be a shorter story. I'll start there. So anxiety, you have stuff like Ativan. Ativan slows your heart rate. It's also called lorazepam. It's the stuff snipers take to steady their aim. Okay, so it could, quote, according to them, have potential for abuse. But if you get into a mental hospital, that's what they give you. Then when you get out, you don't get that because of potential for abuse. What about potential for aid? When everything else under the sun backfires for some of us people. You know? So they don't give you the medications that work, and they overprescribe what hasn't worked. ADHD. I'm giving you the more stereotypical ones. These are the things that have worked for me that I have taken in the past. Sometimes had scripts for it, and you get new doctors or new locations, and they don't feel comfortable with that. They don't want to get sued. A shameful world we live in. Okay, so ADHD is a really good example because a lot of you out there have it. I have it. Did you know that Adderall is legal speed? It's a stimulant. So allegedly you can abuse it. But wouldn't you know it's actually impossible to abuse? It turns out there have been studies on this. Later on I'll give you guys articles and stuff because I have another video on this that I'm going to be giving to my doctor to give her the chance to listen if she wants in her own time, since she's not. She wants to cure the anxiety, but anxiety doesn't get cured from an Asperger's person. It stays. And that's fine. But if you're not going to help me with the ADHD and the other things until you get the anxiety under check because Adderall's a stimulant, or you're afraid of some lawsuit, but let's discuss... Man, nerve pinched in my back, it hurts. Let's discuss the actual facts on Adderall. Did you know that over 70% of children who take Adderall have good results? Over 70% get what they need. So, can you really overprescribe it? Check this out. Over 80% of adults who take Adderall get the help that they need. Check this out. Did you know, because the most common excuse is, Adderall is a study aid. And so people allegedly abuse it for that. But did you know you can't study properly on Adderall? There have been studies on that. And it turns out Adderall will increase your focus and alertness. However, it will reduce your memory. It turns out there is an extremely low memory recall in trials for this. So you really can't abuse it in the method that they're saying. This is what they're saying. I use it to study. I use it to clean my house. No, you don't. Not really. So, those of us who need it have a really difficult time getting it. It's overprescribed by some to those who don't need it, like so much. I'll give you another example. So, I got a kidney stone, right? I told you that a little while ago. And now, when I've had back pain, when I've had bones broken, I've been given over-the-counter medication. I've been told to take aspirin in higher doses and such. It might have been ibuprofen, but you get me. I can't remember. I get them confused because they're tiny drugs that don't do much more than a headache for me. If that. So, in many cases where I could have gotten help with, say, painkillers or something like that, those can actually be dangerous and potential for abuse. I would agree with that. Without making a big deal or nothing. You'd be surprised, though. I don't get those things. Can't get the help you need. But when I get the kidney stone and even tell them and even show them that I already passed it in the office and I feel 1,000 times better when I give them the urine sample, now they give me 15 Oxycontin. I mean, people are afraid. They're afraid to get sued, and they're afraid of confrontation, and they're afraid of dissecting my language, apparently, without feeling this way or that. But I'm not your past. And I guess the point of this video is, one, to raise mental health awareness. I would like us all to be able to do much better. And the service is terrible. I asked for a shrink over 6 months ago. I've called all the numbers myself. I have a case manager allegedly doing it for me, too. I've gotten one. Those of us who want help can't get it. And those of us who are telling you how to help us are going to be denied. To quote my doctor, "Oh, you just want to be helped the way that you want to be helped?" That's not what I said. But I don't like trying a bunch of new medications. I don't like doing stuff that has been proven not to work. And I'm not going to take medications that I'm allergic to. I mean, you get the idea. But because I can tell you I've been on this, and for many years, I went from Ritalin through great in my childhood, first medicine I ever took, I think. And then the Ritalin wore off, and my body immuned itself to it, my doctor said, which is strange. So then they moved me on to the stronger stuff, I guess, Adderall. And it worked wonders. I made straight A's. I focused all of the... To describe it simple, pretend this is a cup, okay? A normal person's level of energy or adrenaline is down here. My ADHD ass is up here. When you give me adrenaline, you can't hold but so much liquid in a cup. It causes it to overflow. When you give someone who doesn't need it, poof, they spike and just fill their cup. Mine lowers. And that allows us to focus because we don't have too much water or thoughts pinging around to distract us from being able to give you our undivided attention that you asked for in class, not drumming on the desk and sitting still and really taking an interest in the schoolwork when teachers also have their own issues and they don't know how to make the knowledge relative and instead make it a chore. You'll find countless examples if you want to teach someone mathematics and they're into sports and you use sports as an analogy, how quicker they will grasp it than simply thinking about numbers on a page. But I'm not shitting on the teachers. I'm simply saying that some of us think and function differently. Okay? I am trying to comply with the world. I'm trying to be a good guy. I'm not evil. You know? And it's just really hard when people want to turn you into an enemy and weaponize your speech to feel threatened when there aren't really threats within there if you're confident or long-winded, or telling them how you're going to have to handle it somewhere else or something if you don't feel that you can work with this person. There's many things that are imagined slights as a cancer sign. I understand. But that's not good for business. It's not helping me. It's not helping Johnny and Susie get the help that they need. And it breaks my heart. So what we need is to treat each person on a case-by-case, individual, you're a human basis. What's your name? Oh, hi, I'm Kevin. Oh, hi, let me get to know Kevin for a little bit. And then make an educated decision. Not immediately slap something that worked for somebody else with totally different brain chemistry without even taking my fucking blood even. Much less measuring my brain. That's not going to help us. We need you to look at the issues. We need you to hear the client express their genuine concerns. This is what I have trouble with. I don't sleep for days. This particular pill makes me hallucinate. Can I have something different? Well, this works for all my other clients. No! You know what I'm saying? This is a genuine, earnest attempt to hope that you guys, and anybody that you share this with, can kind of understand the struggle of an Asperger's person trying to make you happy. We're sacrificing ourselves constantly. What do you want to do? How are you? What's expected of me? Which shape do I take today? If I talk too intelligent, you hate me. If I talk and just let you talk and control the situation, I'm boring. Constantly struggling to figure out what it is you want, and maybe asking questions to determine it. And it's not being myself to shapeshift into what's needed for the task. That is me being myself. That's me making a decision to become this. So when people give us commands, Asperger's, assuming we listen, we take it to heart. This is the information you've given me. We don't have a symbiotic relationship with you. It doesn't work the same. You've given me this information. This is what I expect. Text me. Oh, you're texting me more than I want. Like my landlord, for example, told me to text him every little update about certain issues that don't need to be discussed for the scope of this video. So I texted him this long ass paragraph, but he's an old guy, and I guess got frustrated with the ping 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 of it continuing as it separated into the next one. So he felt threatened somehow. He's trying to twist it into things that it's not. And it's hard for me, because in my mind, I'm doing exactly what you asked me to do until you tell me something else, which is now that that's not what you want, and to do the opposite again, and to keep struggling to find that connection. So I rely on you, in a way, to tell me what you want from me, or to go and do my thing somewhere else. I rely on these doctors, if they worked, to listen to the client, to get to know them and make an educated decision, not a fearful one, of what worked or didn't work for the past, who did and didn't get sued for what actions they did or did not take. I have nothing to do with those memories or fears. They're rational. That wasn't emphasized enough. Irrational. So how can we get the help we need if you're not willing to listen? How can we help you have an easier time? Because some of us are happy being that different thing that we are. How can we help you have an easier time if we can't really comply any harder? Where we're asking you for the answers and you don't know what you want from us. I do my goddamn best. But it is what it is. Constantly shape-shifting. People take a word out of a paragraph to feel this way or that. I don't speak for you, at you. I speak for us, at myself. When I say something about my life or compare experiences as well, let's say I heard something you said, and then I talk about something from my own life. I'm not taking away from the validity of your story or your emotion or your past. I'm actually mirroring you to show you how and why I get it with a story of my own that's kind of similar. It's me trying to fit in. But even that can be seen as some slight to hurt someone. And then we end up condemning ourselves, and anxiety and depression gets 1,000 times worse. 1,000 times worse, because we get lost in the shuffle of the matrix of the paperwork that is thought on who to be, what to say, what not to say, what triggers this person, and just shut down and start to fucking hate ourselves sometimes. Because being confident with ourselves didn't work for you. It seemed narcissistic or talking down to you. It's not. It's just a person being a friggin' person. At what point did I say anything about you? None. So it's really hard. Hopefully this video will highlight some of the... Because I'm one of the more capable Aspergers, I think. I'm sure there's people even better than me. But I've seen many people who struggle a lot worse. And I hope this helps to see our desperate attempt to try to fit into your world, when really we're happy not even being a part of it, for the most part. And we'll handle our roller coasters or whatever as they come. But we're meeting in the middle only to really be resisted against. and told we're resisting, to be mistreated in hospital vans, to go to a hospital, and say, fuck, I'm in pain, and so much pain because I've never been in that much pain in my life, and then to be kicked out of the hospital saying that you're swearing at somebody. That's nothing. This is imagination. And I can't expect everybody to be good at their job or to think as quickly or as clearly or to take the personal time like I might to rehearse and to think about things, and that's unfortunate. Because how I live, I love nerdy stuff. I love education. I want to understand everything. And to me, if reincarnation is real and it doesn't even matter, that means I live forever because I got to keep coming back to see the constantly changing perspectives and information. It's exhilarating. So by all means, educate me. But I'm not a monster. Susie and what did I say the guy's name was? I can't remember. Let's just say Tommy and Susie this time. She ain't a monster. They aren't a problem. They aren't resisting. They're earnestly, humbly coming to you. And you're just breaking them down even further. Making it impossible for them to get the help that they need. I'm 6 months without a shrink. More than that, technically. And I've called every number. I've done what I can, apart from making some big spectacle on the news or something about some of the things I go through. And then the world would pity and then force a change for me due to the level of near global awareness, maybe. But hopefully I can not just broadcast my humility, which is what I'm doing now, and my humiliation as well, of being an imperfect soul like we all are, trying to figure it out, becoming a better person each day, learning from information. But I don't learn symbiotically like you do. I didn't know what this meant until I read it in a book. I didn't know what this meant until I wanted to try to conquer Asperger's and study body language, so that everybody would quit hating me for being disconnected from stuff. And now I do a lot better, considering. But I'm kind of depressed when I'm always a monster, no matter what choice I decide, or no matter what choice you decide for me to make it all be okay. Which language should I use? Which volume? How fast or slow? Everything that people can pick on, and I've done everything I can to meet them there. But their commands are shoddy. They change. And I don't know how to keep up with the emotional flux of the average person. I can absorb all the emotions, but they're all just bad to me. I can try to mimic and mirror that behavior. I'm more you than you can possibly imagine. That's literally how I learn. You yell, oh, it's K to L? Okay, I'll yell. I'm allowed to be emotional too, yeah. You're sad? I'm allowed to be sad that you're sad and support you and join you in sadness. And people are so in flux while I'm surrendering my identity in a way to try to be more accepted. And after learning to love myself, I learned I don't need to do that, but there's still a habit. There's still a chemistry, still a neural pathway that my brain's used to traveling its familiar way that needs time to change. It needs therapy or something to constantly repeat to myself, to learn through exposure, hopefully healthy exposure, the new way of being, to overwrite the hard drive, to take a different branch down the brain. The brain, just so you know, doesn't do what is smart. It does what is fast. Okay? Your brain travels down different circuits to recall old memories, called neural pathways. Okay? So it goes down different ways. That's how you bring up memories. When you're in theta, and when you dream, and when you meditate, you're recalling old memories, and you're creating new neural pathways. They aren't just instantly overridden. That's why religion takes a while to help people. That's why meditation takes a while. Kundalini yoga actually has physical benefits. But it's why the mantras to it might take a while, because you're really convincing yourself. What you're doing is you're spending time with yourself, not the outside noise of what they tell you. And you're telling yourself what new way we're going to be, since the old way didn't work. We are confident, we are strong, we are love, whatever it is that you do. So if I have found love in myself without necessarily needing to seek it from the world, it still hasn't conquered the fact that the world hasn't found that, and that they need me to behave a certain way to understand what I'm saying, to take a moment at their time, to think this guy is different, or whatever it is that's different from me, so that we don't communicate right away immediately perfect. And I think people need to take that time. I think it should be important. I think that if anybody's really going to be helped, they have to be treated human, not inhumane. Not as an outcast or a difference or a word and a label and a problem, an opposition to be the biggest issue. I'm not a problem. Quite the opposite. I'm a problem only to me. I hurt me. I attack me. I get sad for me, you know? So when I talk to you, I'm not thinking of just me. I'm thinking of the fact that we share this space to the best of my abilities. And I'm given education and logic and paragraphs that someone might know who I am, instead of just the fact that I'm quirky, strange, eccentric, euphoric. One day I'd like us all to genuinely have peace, and it's not going to come through this type of judgment. Because I'm not a doctor, I must not have studied apparently even more than they do often. Because of entitlement. Oh, now I'm a doctor, so I'm king shit, so I'm going to stop reading medical journals. I've got my college degree, so I no longer need school. We're here learning forever. Forever, brothers and sisters. So why is it that knowledge is only supposed to work one way? I'm supposed to just instantly get you without data. You don't get me at all. Won't take data. And somehow later on decide I'm public enemy number one, or I'm aggressive or oppositional. No. I'm passionate, bro. I put my heart and soul into everything I do. And it hurts that even a good job isn't good enough. You know? No matter what shape I take, which I'm constantly changing as their ideas change, isn't going to be good enough, because you're not really taking in information. What you're doing is you're blowing a portion of a personality out of proportion. And almost worshipping, only admiring a piece of a whole. And that whole is kind of shattered, kind of broken and compartmentalized into different chunks. So to understand it, you're going to have to actually build a rapport of a relationship. And then you make diagnoses, and then you give pills. There should be a process to it. Not just we hope it works. If you tell me you have bad reactions, you're your problem. You're fighting me. I'm not. They're not. I hope this helps. My life don't matter. The global whole matters. If I help one person in any dumb act, song, stereotype, religion, I support or joke interchangeably to fit my narrative of what I'm trying to express. If I help even one person, then my life matters. But it doesn't matter as just I'm me, because I don't care to live for me and do everything with a purpose. We all should. Don't live for today, build for our future's children's children, right? So if I touched anybody or woke anybody up to any kind of understanding, then I'm doing well, no matter how much I might go through to try to accomplish that. And I hope this touched some of you. Hope this showed you the pain, but also the beauty. The anxiety, but also the pleasure of getting to know the world. Despite the fact that it might not want to get to know me. Helping the world. Giving to others, despite the fact that they might not want to help or give to me. So, once again, my name is Kevin La Liberty. You have ADHD, bipolar type 2, OCD, PTSD, Aspergers. And I'm not officially diagnosed, but can't get a doctor, so dissociative identity disorder, or borderline personality disorder. Nevertheless, don't mistake meekness for weakness. Don't mistake struggle for aggression. Don't mistake your limited understanding of certain words or a new delivery of a combination of them to be an oppositional force, because it's not. If I wanted to love me that hard and think only of me and belittle you, if that was what it was about, I wouldn't be talking to another human. I'd be spending time with me. Instead, I am coming to you and pretending like you're a professional with a degree and a title. You know, that you might be able to give some aid, because I'm humble like that, to think that there are thoughts and procedures and ideas and combinations of word constructs that I haven't thought of yet. And keep myself open. Again, like the ancient Greeks. You know, the only real thing we know is that we know nothing. We always have room to learn and grow. And so I try to have that, but why can't you? So I have to be the monster. I have to be White Devil. I have to be whatever it is for you to understand that we haven't found the communicational connection yet. But I don't think it has to be that way. You know, there are many different ways to communicate and express for that reason, so that all the seemingly contradicting different shapes I take are really to touch different types of minds and hearts, that they can get the same message in the format that works for them. That's what we need from our doctors. For them to be half as adaptable or half as understanding that this thing is different from you. If he already understood, if he already got it, he wouldn't be coming to you as a professional. Or she. Or he, or she, or she, or he. So hopefully this helps. I love you guys. I love myself. We're going to have some hard times. It's almost like this world ain't made for us. But that's no excuse for me to give up and stop trying. It's no excuse for other people to crucify you for trying. And hopefully we can all just get a little bit closer to that humility we need to see the other side of the coin. The part laying on the ground, you know. That we know it as a whole coin instead of just the surface material, scuffed up, difficult to really read what year it's from. So, have a good one. I hope you enjoyed.